Thank you. I recognize the Honourable Leader of the New Democratic Party.
Thank you, Madam Speaker. So the Minister of Health and now the Premier are accusing the opposition of fear-mongering following discussions around the disclosure of personal health information. But these concerns are not originating from opposition members. The Premier can read as many selective letters as he wants, but we know that 35,000 members of the Regulated Health Profession Network, the College of Physicians and Surgeons, sexual assault survivors, and many others have meticulously laid out their concerns about potential abuse and intrusion into patient privacy in this government's proposed approach. What makes the Premier so confident that he knows better than most of the healthcare professionals in our province?
I recognize the Honourable Premier.
Madam Speaker, there are significant obligations under the Personal Health Information Act to keep private information private. Of course that's going to happen. Of course we respect that. But Madam Speaker, I just want to say we have to move forward a system. We need data to manage the system. Now this would be the same opposition, the same negative NDP party that voted against the Patient Access to Care Act. And we're saying of all these things, the sky's going to fall. Guess what? The sky's not falling. That act is working. We're hiring nurses. We're hiring doctors. We're expanding the scope of practice. Our intentions are well. The professional bodies know that. And Nova Scotians have a right to know that as too. We will fix healthcare, and more access to data is part of that.
I recognize the Leader of the New Democratic Party.
We amplified the voices of the professionals on that bill too, because they didn't want the minister deciding who was fit to practice. Yes, there are good parts of that bill, and there are parts of that bill that are open to abuse and overreach, just like this one. It's not clear what this bill is trying to solve. The government has the data they say they need. The explanation of why they need it now is constantly changing. If it's really about Nova Scotians having their own information, then why does the minister need to access it? I don't care what her intention is. Why does she need to lightly touch it? Why does she need to peek at it? What will the access of private vendors be? Even doctors have expressed concerns they won't be able to explain to their patients if asked whether their conversations are confidential. We deserve clarity here. Does this proposal allow access to more than government actually needs? The minister said this morning it was broad. Why?
I recognize.
Why is the door being left?
Order. I recognize the Honourable Premier.
Madam Speaker, here's the reality, and we know that the NDP will be very negative. We'll always try to find the negative for it. The Personal Health Information Act is about 35 pages long and covers what the minister and other custodians can do to protect people's privacy and are required to do. That's a fact, Madam Speaker, and it's an important fact in this discussion. And there's another fact that's necessary. We are committed to making sure Nova Scotians can access their healthcare system. The opposition can be negative and stand in the way of that, but we are moving forward in the best interest of Nova Scotians. That is only what matters to us, and that is our focus. We'll continue to do it.
I recognize the Leader of the New Democratic Party.
Matters to Nova Scotians is being attached to primary care. When I asked Nova Scotians if they would prefer access to test results they can't decipher on an app or a doctor to share those results with them and walk them through them, 100% say that they would rather have a doctor. The Premier referenced Doctors Nova Scotia. Doctors Nova Scotia has brought an amendment. Will the Premier pass it? Will they reconsider? And if not, why not?
I recognize the Honourable Premier.
Thank you, Madam Speaker. And I want to say that people have a right to have access to their health care. And the NDP can find all kinds of negative reasons why people shouldn't have access to their health care. We don't agree with them. We are on the side of Nova Scotians, and we believe they have a right to have access to their healthcare information, and we're going to make sure it happens, Madam Speaker.